It's hard to tell patients that they have cancer. Patients know when they come into our clinic that they're potentially at a higher risk of having a cancer diagnosis if they don't already carry that diagnosis with them. But when I have to tell a patient for the first time that you have cancer, I don't take that lightly. I know that that is a often life-altering word to use for that individual. And I know that that will have huge implications, not just for that visit that we have on that day at that time, but that's something that they're gonna make phone calls after our visit. They're gonna call their loved ones, their friends, and also explain that to them. So I know that those moments that I have with the patient and I tell them, you have cancer, the ripple effect just continues from that moment. But what I like to offer our patients is a sense of hope, a sense that we're in this together, that at Siteman we have a huge team. So for each patient that does have a new diagnosis of cancer, or for folks where we're having to reconsider treatment options, we present our patients at our Multidisciplinary tumor board. There we have GYN oncologists, we have pathologists, our radiation oncologists, and so we have this really special meeting every week to talk about these patients so that we come up with the best plan for that patient. So when I see that patient in clinic, they know that not only is this a plan that I've thought about, but also one that all of my colleagues have thought about. And I think that patients get a lot of comfort in knowing that. Really, it's a huge group effort to take care of them. There's a lot that goes on behind the scenes and a lot of work that goes into each visit, even if that visit in and of itself is only 10 or 15 minutes. I've wanted to be a physician probably since I was about 8 years old, and I have one of those birthday posters that you have to make in elementary school, and it said, what do you want to be when you grow up, or future career? Mine said, a doctor mom. And so I have stickers of kids, and I had doctor stickers with stethoscopes and a white coat, and I still have the picture of that birthday board that I had made as a child. At the age of 8, I don't know what really at that point made me realize that, but it just only kept getting more and more real until it was real. And in terms of gynecologic oncology, I knew I wanted to be in medicine. I loved helping people, and I was good at science, so it seemed like a natural mixing of the two. Gynecologic oncology is a specialty that focuses just on cancers and precancers of the female reproductive tract. So that includes everything from the vulva, the vagina, the cervix, the uterus, the tubes and the ovaries, and then the peritoneum, which is the lining of the pelvic and the abdominal cavity. Our specialty is, again, very unique in that we do not only the surgical side of things, but we also do the chemotherapy if it's indicated. Keeping women healthy and doing the things that they love to do is a passion of mine, and it's a passion of all of my colleagues. So what's special to me is I get to meet a patient. We may or may not know at that first visit that they have a diagnosis of a cancer. Ultimately, we'll likely need to incorporate surgery into their plan. And then after that, I also am the physician that gets to give them their chemotherapy if it's indicated. We then follow these patients often for years, so we really get to know our patients extraordinarily well. We know them not only as our patients, but also we get to know their families, so we see them as mothers and sisters and daughters as well. I think that treating the patient and also their family is key. We know that these patients wouldn't be able to go through these treatments with the success that they do without their family support. So we love it when our families come in with our patients, and often they're also sitting with them in the infusion center, which is right next door to our clinic. So we get to know them also. So I would say that absolutely they're an integral part of their treatment. So patients should come to Siteman to get their cancer care so that they know that they're getting the best. Oftentimes we'll have folks that are coming in from the community where they've already had a visit with another provider or practitioner, and they just want to have another set of eyes on their chart to know that there's nothing that we would be doing differently. Oftentimes there might not be something that we would add to their care at this time, but I think that gives some patients some comfort. So we're also happy to see patients for second opinions, third opinions. That's no problem with us whatsoever. It's one of the best feelings when a patient is nearly complete or has completed their treatment. In our infusion center, we have a bell, and so when patients have completed their last infusion, they get to ring the bell, and everyone that's getting their chemo that day is very excited for them and happy for them. The nurses are there. Generally, their gynecologic oncologist will also be there with them, and it's definitely an emotional and extraordinarily happy moment. And you feel in that moment a great sense of gratitude for everyone that got that patient there and through all of their treatments, and knowing that now they can go back and do the things that they love to do with their friends and their family, whether that's just attending more birthday parties, or some of my patients, they say, I knew that I was okay when I could go back to my Bible study with my friends, or I was able to go make that summer trip with my daughters. And so I think those are the moments that make it all worth it.